little health and a little wealth and a lot of love.
Tell me about the treatment plan. So what can people do about this?
Yeah, and something that I didn't mention, this is another thing that comes up a lot with my patients, is just that they had blood work done and everything looked normal. So they didn't have the high testosterone level. The LH and FSH, they get the hormones done and everything looks completely fine. And they're just told that, everything looks okay, nothing's wrong, which is why some of those other diagnostic criteria come in. But with a functional medicine look on things, they also do some more extensive testing. And so they'll do things like a salivary cortisol or urine hormone metabolites, dry urine test. So things like the Dutch test is one of the brand names that they use, which I don't have a lot of experience with, but from the lectures that we've been going to, it seems like it gives a bigger picture. So it's not just what your serum, what your blood levels are showing right at that point in time, but it is a little bit more dynamic. So it might show the specific metabolites, how your body is processing these different hormones. And so I think it gives some additional information to guide your treatment and tell you a little bit more.
Gotcha. So you would recommend folks asking for these tests, is what I'm hearing.
You can't ask for these tests. You can't go to your primary care or your conventional OBGYN. You can't go and ask them for these tests because it's not something that is validated by conventional or traditional medicine, which is where a lot of the controversy lies. Because a lot of people will say these are just unnecessary tests, they cost a lot of money, and it's not going to change management, which I can agree with. I think a lot of women just want a lot of answers. They want to know, they want to know as many data points as they can find. But I agree. I don't think it would necessarily change management. If you've got hirsutism, if you have abnormal periods, if you have signs of insulin resistance, if you have high testosterone, you've got the classic findings, then I don't know if we necessarily need to do all of that extensive testing, because I don't know if that's really going to change the management.
Gotcha. And so let me summarize that back for people. And, I'm a novice. I'm learning this stuff with y'all. So I think about traditional medicine being far right. I think functional medicine being far left. Emily's in the middle. So what she's saying is these tests are great. And we're in a society where the information age, everyone wants to know everything about everything. And I agree that you should know as much as you want to know about your health. So if you ask for these tests, even though it doesn't change management, yes, it may be expensive. That's a decision you'll have to make. But at the same time, I think it's very novel that you are interested in that, because I know that you had patients in the past who saw functional medicine specialists. Long and behold, didn't know that's the path you're going to go. Yeah. And, a lot of doctors just roll their eyes, say, oh gosh, who you been listening to? Human Lab or Juice and Scrubs podcast, hopefully. So how was PCOS treated?
So the other thing I was going to mention too, that I don't want for people to forget, is that if someone is having signs of androgen excess, so if someone is having those classic signs of the hormonal acne and hair growth, especially if it's sudden onset, and especially if it's in an older woman, you need to rule out everything else. This should be a diagnosis of exclusion. And so there are certain types of cancers, certain types of tumors that can excrete testosterone and cause these symptoms. And then there are also other types of conditions, like there's something called congenital adrenal hyperplasia, and there's also late onset. And so basically your adrenal gland is hyperactive and producing too many hormones. And so there are other causes that can look very similar, but the treatment will be very different. Or you don't want to miss someone who has a tumor that you can potentially, like an ovarian tumor, that you can potentially remove and cure them of cancer.
With a little health and a little wealth and a lot of love, that's the life that we live.